Assembly when the 7th of April was decided that it should be commemorated as World Health Day. Today, the day is being commemorated in Opuwo. I'm now joined by Health and Social Services Minister, Dr. Kalumbi Shangula. Dr. Shangula, as we commemorate this day, we are commemorating this day globally. From the Namibian context, what does it mean? What has been achieved so far as we commemorate World Health Day?
Yeah, Namibia is a full member of the World Health Organization, becoming a full member upon the attainment of independence, although Namibia before enjoyed the observer status during our liberation struggle. Today we are marking the 75th anniversary of the founding of the World Health Organization. As a full member of the World Health Organization, Namibia has participated fully in all the activities of the World Health Organization, where decisions are being taken at the World Health Assembly, at the execution, at the executive board, and also working together with country offices, especially during difficult times. We recently remember that during COVID-19 pandemic, we have worked together with the World Health Organization, especially giving us technical and other support to fight the pandemic. That also includes the procurement in order for us to get the vaccine to protect our people. And during the latent period, so to say, outside the crises, the World Health Organization is working together with the Ministry of Health and Social Services to build up systems that will be resilient in fighting both communicable and non-communicable diseases. And it was through these collaborations that Namibia have achieved a lot in terms of access to health services, in terms of prevention of diseases, in terms of curing many of the diseases, especially the non-communicable diseases.
Thank you very much, Honorable Minister, for joining us. I'm also joined by WHO country representative in Namibia, Dr. Charles Sago Moses. Dr. Moses, this day was initiated by your organization, WHO. What are some of the milestones that has been achieved as this day is being commemorated globally?
Well, thank you very much. For 75 years, we've been working very closely with member states to ensure that everybody, everywhere, anywhere has access to healthcare without suffering financial challenges. And through that, we have been able to eradicate smallpox in 1979, declared in 1980. We've been able to bring down polio cases from almost a third of a million to only 6 cases as at last year. And we've been able to do what we call Framework Convention on Tobacco Control to ensure that the ill effect of tobacco is minimized. You remember the COVID pandemic and how the WHO worked with countries to ensure that the pandemic is reasonably controlled. And we are not out of the woods yet, but we continue to work with countries to ensure that that is done. So we are happy that after 75 years, we have increased, we've helped to increase life expectancy and many other benefits in terms of bringing disease under control, like HIV, for instance, malaria. Take Namibia, for instance. They've done very well with HIV, with malaria, and other conditions. We've just last year, we declared that hepatitis A virus infection was over. So many things have happened in Namibia. Namibia has been part of the World Health Organization for about over 30 years, since independence. But Namibia is being a very, very important member, very active member, ensuring that the decisions of the World Health Organization, they actively participate, But then at a country level also, they ensure that they implement policies and put up strategies to be able to implement these strategies with the aim of ensuring that no one is left behind, which is what the government is interested in, and as WHO, we are partnering to do that in health.
Thank you very much, Doctor. I'm also joined by the Mayor of Opuwo, Ms. Rosa Mbinge Cheundo. In your welcoming remarks, you have mentioned that there is a need for a second hospital here in Kunene Region because the population has increased. Can you please elaborate on that?
Okay, thank you so much. As I can remember very well, the hospital in Opuwo was built in 1973. Imagine when you can think of the population of that time and the population of today. And Opuwo being the capital of Kunene Region and currently catering for Sesfontein constituency, Opuwo Rural, Opuwo Urban and Pupa, the population is really increasing, meaning that we need a second hospital or what we call a referral hospital, because this hospital currently cannot take up for the population in need. That's actually what I meant, because in education where I'm coming from, we are having classroom of 35 learners with a teacher. So we need the same at the hospital also. It should be built according to the number of people living in a certain area. So Opuwo is really in need of hospital, and we really have cases of people being at the hospital for 1 to 3 days without being catered for because of the facility itself and the nurse and the doctor ratio. So that's what I mean actually in short.
Good health is a fundamental human right, and this is why the Namibian government has made it a priority to ensure that good healthcare facilities brought closer to the people. From us here, Tonatenia Imbodi and Simon Nyman is back to in studio.